Can you tell me what brought you into my office?
Well, I was dealing with face pain for at least 20 years. I had a I've had a history of sinus issues, and I had a particular sinus procedure done around 2000 where they did a Caldwell procedure, meaning they went through the roof of my mouth to get a cyst out of my sinus cavity. And ever since then, I've had this horrendous face pain. I've had teeth removed, I dealt with dentists, I dealt with pain meds, I've done it all. Nothing worked. And I've been on narcotics for probably 20 years, up until the time I met you.
Okay. Narcotics including morphine?
I have morphine, IR, Cadian, which is a time-release morphine. I've been on Oxycontin. I've been on every type of narcotic you can imagine over 20 years. And quite frankly, none of them really worked.
So when I saw you, I was able to replicate your pain just kind of by pushing in the area with a Q-tip.
Yeah, I can still feel the divot in my face where they took the cyst out. I mean, I've had 6 or 7 sinus surgeries where they go through the nose, and I call it a roto-rooter job, but this particular time they couldn't. And yes, you were able to replicate it, and I could do it right now if I wanted to, but I'm not going to.
And what did I recommend, and what have you been doing the last couple months?
Well, you prescribed this kind of funky dental stent. I don't know if this is gross, but that's what it is.
Okay, just kind of hold it a little bit still. Perfect.
Okay, and I had to go through a fitting process, and I put this in my mouth, and I put some capsaicin ointment on it, and put it in my mouth. While I don't love wearing it, it's just there, and half the time I forget about it. I'm a public speaker, I teach, and it's a non-issue. I've worn it for the last 6 hours this morning with no issue.
And you reapply the medication about every 2 hours?
Yeah, about every 2 hours, sometimes a little sooner, sometimes a little later, just depending on where I am. I take it out and I apply it with a syringe, and I put it back in my mouth. And I've come pretty good at doing that. I keep a syringe in my car, I keep a syringe in my briefcase, and of course I have one at home.
And what kind of medications have you been able to decrease or get off of?
Well, since October, when I started this process in earnest, I've gotten off of around 5 to 6 morphine 15 milligram tablets a day, and I've gotten off of Cadian 100, which is a time-release morphine. I'm virtually medication-free. I'm still titrating down and expect to be there by in the next week or 2.
Fantastic. So the pain's essentially gone.
The pain is essentially gone. Yeah, I mean, there are times where it comes back, but generally speaking, it's gone. And when it does tend, in my mind, to flare up, it reminds me to take the device out, put some more capsaicin on it, and I don't know, technically it stings it away, it makes it go away. So I'm very happy to be off all this medication that I've been on for so long. I'm delighted.
Fantastic. Thank you.